Thank you for joining us once again. Welcome to everyone else. Thank you all for joining us, and let's dive in with our January 22nd COVID-19 update for the city of Burlington. We have a number of topics to get to. We're going to start the way we always like to, talking with President and Chief Operating Officer of the UVM Medical Center, Dr. Stephen Leffler. Dr. Leffler, welcome back. We remain in one of the most intense periods of this pandemic. We're all feeling that. How are you experiencing the situation currently up at the hospital? We remain at about 50 cases a day in the county on a 7-day average. You can see on the dashboard up there on the screen from the city's dashboard that is, more or less, maybe a little bit lower than where we were at the peak of this. Let's hope, but too early to say, I think, whether we've seen the peak of this wave. Be curious your thoughts on that, and how is our critical healthcare capacity doing right now?
So, Mayor, we continue to be in pretty much a steady state, and we're in good shape. So today at the medical center, we have 16 COVID positive patients in the hospital. We have 13 on our COVID floor, and we have 3 patients in our ICU. We have no one on a ventilator today, and we have reasonably good capacity. So we are really, we have capacity to take care of more patients if we need to. And we've varied in the past week between a low of about 11 or 12 up to about 20. So we're in a steady state.
Excellent. Let's talk a little, I know the topic on everybody's minds right now, more so every day as we get closer to next week, the start of community distribution of the vaccine is vaccinations, and how that rollout is going. One of the most critical factors is the supply of the vaccine that the state is getting from the federal government. It's really, we are that's the key step in how this works. And one fact, and the supply hasn't been enough so far. It is lagging behind where we all hoped it would be. One factor that could increase the supply of vaccine would be the approval of additional vaccines as safe and effective. And I know that one of those that there's considerable hope for is the AstraZeneca vaccine that there's a trial that continues to be underway here with the UVM Medical Center. So is there anything more you can tell us about that trial, Dr. Leffler?
Absolutely. So there's a bunch of stuff going on with vaccines right now. And I agree with you that we're ready to go for our community members next week in partnership with the state and other providers in the area. And early on, we're hearing that there will not be enough vaccine to go as quickly as we'd like to. What will help ease that is getting other vaccines brought on board. And so the next two that are going to be coming are, number one, a vaccine from Johnson & Johnson. I actually heard from Dr. Fauci this morning that he's optimistic that in the next 3 weeks, maybe, they would be able to review data for the Johnson & Johnson vaccine and get that out there. And I'd heard there may be as many as 100 million doses of Johnson & Johnson vaccine. And there's a couple of nice things about that one. It's easier to store. It doesn't require the intense cold climate. It's much less likely to have to be wasted. With the current ones that we have now, both Moderna and Pfizer, there's a lot of rules around once you thaw it out, how quickly you have to give it. And so Johnson & Johnson is easier to store, and it's a single dose. And I heard that they may be as much as 100 million doses of Johnson & Johnson that could be rolled out over the, I would say, mid to late spring to the summer. So that's very encouraging. They actually have their data a little bit more ready than AstraZeneca, although I heard that's coming too. So honestly, in the next, let's say, 4 to 6 weeks, both of those have the opportunity to get in front of the CDC for review and ultimately be approved for emergency use. That would really make the vaccine supply really much easier to deal with and much easier to store. In a rural state like Vermont, it'd be easier to get those vaccines out everywhere, much more like we do the flu clinic. So I think there's reason to be optimistic. And I can also tell you that in terms of vaccine uptake, at the medical center for staff that were approved for getting the first doses by the state, we had about a 90% acceptance rate. So 90% of the people that were able to be vaccinated chose to be vaccinated. if that happened in Chittenden County in the state of Vermont, that would bode really well for getting this thing behind us. If we could get vaccination rates of that type of amount for Vermonters, that would be amazingly good news.
Excellent. Can you just repeat that again? So in this first phase that was focused on healthcare workers and long-term care residents, what UVMC had visualization into at least had 90% uptick?
Yes. So we were hoping to vaccinate 7,177 of our staff that are coming out of the hospital on a daily basis. And our goal was to get all of them vaccinated to make the medical center as safe as it possibly could be for our patients, as safe as possible for people to come in who have cancer or immunosuppression or a sick child or having a baby. So our goal was 7,177, and we got as of today, more than 6,500 of those chose to be vaccinated. That's amazingly encouraging for getting the vaccine out there and for acceptance rate. So I think that bodes well for Vermont.
Is there anything else, Dr. Leffler, you can share with us about UVM Medical Center's experience getting healthcare workers vaccinated?
Yeah, in general, we did not have high side effect rates. Some of them complained of mild arm pain and being tired after the first dose, but no one had serious side effects. We had a couple people that had very mild allergic reactions that were dealt with without difficulty. It's interesting, for the second dose, we have a lot of people now, more than 2,000 medical center employees have gotten their second dose. And in the second dose, slightly more people said they didn't feel well for 12 to 24 hours. But I talked to a bunch of people yesterday, so they had no symptoms at all. Like after the first dose, they got a sore arm, and after the second one, it was nothing. So very encouraging that people got through vaccination without big problems. And I know that the uptake in our nursing homes also was markedly strong. I can't give you the exact percentage, but I heard from the state that nursing homes in general, the uptake from patients and staff was very, very high. So that's really encouraging for Vermonters. And I hope Vermonters follow the lead of the healthcare workers. Excellent.
Anything else you'd like to share, Dr. Leffler, before we leave you?
One last comment.
Great.
So as our community starts scheduling to be vaccinated, please only schedule yourself once. Don't put yourself on 2 or 3 times, making sure you're on there. And please do everything in your power to show up for that vaccine spot. Especially with the Moderna and Pfizer vaccines, someone's thought out a dose for you, they have it put aside for you, and if you don't get it, that's going to potentially lead to wasting that dose. We'll do everything in our power not to have that happen, but what you can do is, we want you to get vaccinated. Sign up, show up, sign up once, and then that will be the best thing we can do to make sure every dose goes in somebody's arm.
Great. Excellent. Well, thank you for joining us once again. Good luck with all your challenges. We'll talk to you again soon, Dr. Leffler.
Talk soon. Thank you, Earl.
So the next topic we wanted to address today is the return of UVM and Champlain College students to the campuses and the return to in-person learning, which is anticipated to take place over the coming weeks, the early part of February. That puts us in a period when many UVM and Champlain College students will be returning to Burlington after an extended winter break. We've done this twice before over the course of this pandemic, both in June when we saw numerous off-campus students return to the area, and then again in the fall as classes began. And both times, both of those periods were successful. We did not see a surge in infection levels of the virus. And in the fall, the in-person classes resumed with very few infections and quick containment of outbreaks on the college campuses when they occurred. UVM and Champlain College, I want to be really clear, I think should be commended for their organizational and financial commitments to making that performance happen during those 2 periods, and being collaborating with the city and with the state and the hospital to ensure that happened. And the college students of Burlington deserve our appreciation and praise for their sacrifice and commitment to keeping the whole community safe, even though that they as individuals were not in one of what we consider the high-risk groups for this virus. As a result of all of that work, Burlington bucked the national trends in the fall, and the return of college students did not result in the spikes in infections and nursing home deaths that were seen in many other college towns. So now, though, the challenge is we have to do this again, and it's going to be harder this time in some ways because there's a much higher prevalence of the virus in the community than there was in the fall. And I know that this is a prospect that raises concern, and I've been wanted to talk about it. I've asked representatives of both UVM and Champlain College to join the briefing today to share directly with the community what they're doing to ensure a safe return for students again, any changes that they made from the fall, and why they're confident that they can do this safely, even in the face of what we all know is a significant increase in the prevalence of the virus in the broader community. Let's go to UVM first. We're joined by Wendy Koenig, who is the Director of Federal and State Relations, and Gary Durr, the Vice President for Operations and Public Safety, both of whom have had very large roles with the university throughout this pandemic and keeping the campuses safe and engaging with the community. So Wendy and Gary, welcome.
Thanks so much for having us today. Can you hear me?
Yes, we can. Go for
Great.
it.
So I want to thank you for having us here to talk about return of students to campus, which we're very excited about. And I want to echo what you said, Mr. Mayor, about thanking our students, both from UVM, Champlain, and students across our institutions in Vermont. Without their wonderful and committed cooperation, we wouldn't have been able to have the safe semester that we did. So we applaud them for their efforts. We have encouraged them to double down on those efforts as they come back to campus in order to keep our community at UVM, at Champlain, and within Burlington safe. I think one of the keys to that is our strategy around testing. And I think that's particularly true in the pre-test that we're doing at UVM, but I'm going to turn it over to my colleague, Gary Durr, who has been in charge of our COVID response at UVM, to talk to you about what will be happening in the next few weeks. Gary.
So thank you very much, Wendy, and thank you, Mayor, for including us in this session today. And like you said, I'm incredibly proud of what our students accomplished, both UVM students and Champlain College. And it's been made possible through a wonderful partnership with the City of Burlington, as well as with Champlain College. And we're confident we can do it again. As you said, we had a very successful fall semester with low positivity rates. I think that some of that is owed to what you mentioned, which is a very aggressive testing protocol. As of this week, we've tested about 175,000 people at UVM since it started back in early August, and we're going to continue that. Our students are going to be required to do the pre-arrival test before coming to campus in the next couple of days, and we've seen good response from that already. Every student will do a day 0 test when they arrive, and then they will do a day 7 test, and then they will begin their every 7-day testing protocol for the rest of the semester. The other thing that we felt like we did very effectively in the fall was to, once we learned of somebody who tested positive, to effectively isolate them from the university community in a safe and caring way, and then also do the contact tracing with those students so that we can identify people that were close contacts, and then quarantine those people that needed to be for the period of time. And we found that 3-prong approach to be very successful, and we would get on it almost as soon as we would get notification of a positive result. And we plan to do that. We've looked at those procedures, we've tweaked them a little bit and modified them so that we can be as fast and rapid in response to that. The other thing, and people keep asking me, what are we doing new at the university? And it really comes down to what tools we have in our tool wheelhouse really have not changed since this all started back in March. And those are wearing our facial coverings, social distancing, and personal hygiene. And we have doubled down on that in our messaging to students and making sure that they are aware that we need to continue the dedication and the steadfastness around that so that we continue to have the success that we have. We're considering that continuing the messaging that we've been doing on campus about that, and just making sure that people, especially as the cases are up both in Vermont, but also across the country, now more than ever, it's going to be important to continue that step. The other thing we're asking our students to do is to reaffirm their commitment to the Green and Gold Promise, and that has been going on right now. So we're optimistic for a successful semester as well. Thank you.
Thank you, Gary. Thank you, Wendy. We're now joined by Danielle Barub, who is the Vice President for Student Affairs and Institutional Emergency Management Coordination from Champlain College. Danielle, thank you for joining us. And how is it going at Champlain?
Well, hello, everyone. Thanks for inviting us today, and we're happy to talk about our reopening plans. I'd like to begin by expressing my appreciation for the work of the mayor and your team in terms of managing the pandemic. Champlain continues to be committed to working in partnership with the city and the state to ensure the health of our Burlington community and neighbors, in addition to our students and employees. We're very aware that the virus is more widespread than the fall, and this creates a more challenging landscape as we approach the spring. Our approach is going to continue to be rooted in the guidance that's been provided by the state, as well as our all hands on deck philosophy. And I too would like to highlight that a significant reason for our success in the fall was our students understanding and adhering to our health and safety protocols. Our experience is that students understand and are invested in mitigating risk for themselves, their loved ones, and our community. In addition to student compliance, we will also continue to implement many measures that served us well in the fall. This includes de-densifying our residence halls, the required daily health screenings, as well as required weekly surveillance testing for those living or interacting on campus. And we're also going to continue to educate and enforce our health pledge. Champlain's implementing a phased approach to reopening our campus, with phase 1 being a campus quarantine as students return. And in accordance with state guidance, most of our students will need to quarantine. And so with that in mind, we're going to welcome students back in 2 waves. The first wave of the return will actually be this Saturday and Sunday, the 23rd and 24th. And this group of students will be quarantining on campus upon their arrival. They're going to receive a day 0 test and a day 7 test, and they'll remain in quarantine until they receive a negative test result from that day 7 test. Our second wave of students will return February 4th and 5th. These students will have completed a quarantine at home. They will have also conducted a pre-arrival test within 5 days of their arrival to campus and submitted a negative test result. When they arrive, they're also going to receive a day 0 test from us upon arrival, and will go into quarantine and be in quarantine until they receive a negative test result from that test. Our classes will begin January 25th, and for the first 2 weeks are being offered exclusively through virtual instruction. And our campus quarantine will conclude just prior to when faculty can begin offering in-person instruction beginning February 8th. During that week, we're also going to enter phase 2 of our opening, where in-person services will be available and students will be able to utilize common spaces while masked. And at that time, households will be limited to those students who share an apartment or a room. And as soon as it's safe to do so in phase 3, we'll expand that definition to allow students to gather with a few other people. Champlain, we're privileged to offer a variety of housing options, and our definition of households at phase 3 will be specific to the various types of housing that we have on our campus, which span kind of our iconic Victorian mansions through more modern style suite and apartment style buildings. And of course, our definitions are going to be guided by the limitations and the guidance provided by the state to Vermont colleges. I would also just like to remind everyone that we continue to post information on our website where everyone in the community can go for updates, as well as FAQs. And we will continue to routinely post aggregate information pertaining to test results on our COVID dashboard. So for additional information about our reopening plans, I would encourage everyone from the community to check out our website.
Okay, excellent. Thank you, Danelle and Wendy, Gary. Appreciate those thorough updates. We are, from the city side, we will continue to organize these weekly meetings that I think have been an important part of the collaboration between the institutions, so we can be in good touch as issues emerge and be aware of how each of these different elements of the box-it-in strategy, the testing, the quarantine, the enforcement, isolation, how all that is going. We're committed to continuing that kind of coordination through these key weeks ahead. And we'll have you back here if there's more to report to the community on how this is going. Well, if you could, the three of you could stick around there. I expect there may be questions from the media at the end. I actually have one more question for the UVM folks. I know a lot of my constituents have questions about. Sorry to spring this one on you, but just the new structures that have gone up on the Redstone campus, and I think maybe elsewhere in the campus. Can you say what those are about and how those are going to be used during? I think they are part of your pandemic planning.
Sure. Thank you, Mary. I'd be happy to address that. During fall semester, we had 3 large tents on campus that we used for open space for students to use for meals, for studying between classes, just a place to hang out and even do a remote class from. Those tents were not winter-ready tents, so we had to remove those tents right around Thanksgiving, and what we put up were winter-ready tents, more secure, able to handle the snow load, but also heated. We're going to use those for a slightly different purpose. Something we heard from students was they were looking for more opportunities for locations to interact informally. We had to take over a lot of spaces on campus to help us with our dedensification. So large spaces that were where we could do programming had to be turned into classrooms. We've basically taken the tents and divided them into 1/3 of it being dedicated to just tables where students could go in and sit, 8-foot tables, 2 people at either end, where they could study, they could have their meals, same thing. But then what we've done is we've put in Adirondack chairs around coffee tables on either end so that people can sit physically distanced apart, masked, but have a way to interact in a social way that they couldn't otherwise do in the fall, because we had to use those spaces for other reasons.
Excellent, Gary. Thank you. That sounds really creative and another example of the kind of investment that both institutions are making to make this work in these very unusual times. So stay tuned. We may be back with you in a moment. We have a couple more topics we want to cover quickly. We want to say a number of things about vaccine distribution. In addition to what we heard from Dr. Leffler, we wanted to share additional information about what Burlingtonians should expect starting next week when phase 2 of the vaccination plan opens. So first of all, the state has announced that phase 2 of the vaccination plan is going to begin on Monday, January 25th. And it is very important that all older Burlingtonians and their families understand how this is going to work. Here's what we know, what we don't know about what Burlingtonians can expect starting on Monday. So first of all, everyone should know that vaccines are free. They are free and they are safe. Starting on Monday, all Vermonters 75 and older will be able to sign up and receive the vaccine. You will need to reserve an appointment to get the vaccine. All of the appointment slots in the state for the coming 5 weeks will be released at the same time on Monday. There will be enough slots for everyone age 75 and older, although you may not receive the date or time that you want. You can reserve an appointment in 2 ways, by phone or online. The phone lines may be overwhelmed, even though the state has advised us that they plan to have hundreds of staff available at a call center. That still may not be enough to keep up with the demand. So whenever possible, the city and the state are encouraging people to sign up via an online portal. If you have a parent or a grandparent who isn't used to using the web, please help them sign up. The call center and the website will both become operational on Monday. And we know that the state has been working hard to attempt to ensure that these systems work well when they go live and avoid the kind of problems that other states have experienced. I had a conversation with Dr. Levine and a senior official from the Agency of Human Services yesterday, and they described significant testing and attempts to ensure that this system is going to work. And so we know that a lot of effort has gone into that, but there's no guarantee when you're doing something new and innovative like this. The reservation appointments, the appointment slots will be filled, and this is important. They will be filled on a first come, first served order. So we encourage you to be prepared and to be ready to sign up as soon as the sites are open on Monday. The state has not yet announced what time this will open, but they have said it won't be right as the clock strikes midnight and likely will go live in the morning. The state will be releasing the website and phone number on Monday when they go live. So we can't share with you now what those are. We don't know what the phone number or the web address will be. That will be announced Monday. You can look for the information. Here's how the fastest way to find out is you look for the information on the Department of Health website. And there on the screen is the web address. Pretty straightforward. healthvermont.gov/myvaccine. There will be several different locations in the Burlington area that you will be able to register for. Again, we can't announce now what those locations will be, but I have been assured that there will be Chittenden County sites and sites close to Burlington. Once you make an appointment, it is very important that you keep your appointment. There are also things that we don't know yet, and there are challenges that will make this a difficult process that will require patience. Burlingtonians should know that this is going to be a huge undertaking, and it is likely to take some time, likely over a month for even just those that are 75 and older. That 5-week projection is based on the current pace at which the federal government is distributing vaccine to Vermont. If that accelerates, as we know the new Biden administration is very focused on doing, that timeframe could improve. Currently, Vermont is receiving only 8,000 doses of vaccine every week. There are about 50,000 Vermonters who are 75 and older. So at the current rate of supply, it will take several weeks to vaccinate those 75 and older who want the vaccine. The public can track the number of vaccines being distributed here in Chittenden County on a new page on our COVID-19 dashboard and on the city website. So we're really going to try to make all that information available to you to help us all kind of manage our way through this and understand what's going on. And Olivia has just pulled up some of the images that are now the ways in which you can track vaccines on the dashboard. There's a number of new ways to visualize that information there. Of course, again, this pace will change if the federal government is able to increase the supply of vaccine that is going to every state. A way that could happen, we touched on at the top of the show, if another vaccine becomes approved, the AstraZeneca vaccine or the Johnson & Johnson vaccine, that could significantly impact the pace at which the doses are reaching us. I want Burlingtonians to know that we have been in conversation with the state. The state is leading this effort for the vaccination effort. The city has no formal role in the vaccination effort, but we have been in close conversations with them for months about the vaccine distribution and really been talking about the details in recent weeks. And I want Burlingtonians to know that there are really 3 important things that I've been advocating for in these conversations. Been important to me that the vaccine be allocated, the limited supply by the size of the target population. Walkable sites are critical right from the first week. It shouldn't be that all the sites require you to drive there, especially in a city where 15% of the population does not have access to a car. And it needs to be a real priority that communication and outreach to our BIPOC communities is strong. And I have some updates to share in each of these areas. First of all, in terms of the allocation, the state has assured me that vaccine distribution will be proportional by the age of the residents in that area. I was concerned that, as sometimes happened, the larger population of Burlington would not be accounted for in the state allocation planning. But that's not the case here, which is critical because this is a life-saving vaccine and it needs to be distributed fairly. We have been advised to expect that 21% of the vaccine doses in this phase of the distribution, the 75 and older phase, will be coming to Chittenden County because about 21% of Chittenden County, about 21% of the target population of the total Vermonters over 75 and older are in Chittenden County. And that's what that's what the state is expecting to match that distribution ratio. In terms of transportation access and walkability, we want vaccines to be available for our residents who don't own cars or have jobs that make longer trips in the middle of the day unrealistic. And while the local sites have yet to be announced, we've received confirmation that there will be walkable sites starting next week in Burlington and Winooski. And finally, in terms of communication and outreach to our BIPOC communities, and especially our communities where English proficiency is an issue, a major effort is underway to communicate with those parts of the community. The city is working with many partners that include the UVM Medical Center, the city's Trusted Community Voices program that we set up in this pandemic, the school district, professionals of color, AARP, VSIL, the Association of Africans Living in Vermont, AALV, the U.S. Committee for Refugees and Immigrants, and others. We have a listserv with about 20 partner organizations that include refugee and immigrant and BIPOC community organizations that we share this information with. And we're using that network thoroughly right now. Our communications also include a network of senior care providers, temporary shelter providers, pediatricians, and the general public through forums like this. That said, despite that kind of education and outreach, this is an area where I still have some concern for a few reasons. And I say this while also being very appreciative of how hard the state is working to try to make this plan work. I continue to have a concern about this first come, first served initiative, since all the available slots, currently my understanding, all the available slots will be released on a first come, first served basis by the Department of Health. When you combine that with a limited supply of doses and the fact that the registration portal online is in English, and that there is a hesitancy about the vaccine in some of our vulnerable and historically marginalized communities, that combination of factors gives me pause. We know that throughout this pandemic, first come, first serve initiatives have often been biased against BIPOC and limited English proficiency communities. And I'm talking about a national trend, not just local events. We've been talking to the state for weeks about the vaccination plan and appreciate that they have taken many steps. We were briefed late yesterday on the full plans. And again, while appreciating the hard work the state has put into this, continue to have some concern. We will continue to be in contact with the state to explore how more can be done to ensure that BIPOC members of our community, especially those with limited English proficiency, are able to access the vaccine equitably over the coming weeks. We stand ready to do everything we can to support the state's vaccination effort, and we'll be monitoring the progress, advocating for all our residents, and seeking to learn what we can from other states or countries to help make this process more efficient in the weeks ahead. two more topics I'll try to cover quickly. Wastewater monitoring. We announced on this briefing last week that we've started using our wastewater monitoring program to test for new variants of COVID-19, and in particular, the B.1.1.7 variant that was first identified in the UK, and that we know to be highly contagious, more contagious than the original strains of the virus. Our hope here is that by adding this component to our wastewater monitoring program, we can get a better idea of how the threat of the virus is evolving locally. Brian Lowe, our Chief Innovation Officer and one of the architects of this effort and this capacity, is here. Brian, what kind of update do you have for us?
Hey, thanks very much, Mayor. A quick update for you today, which is we've now conducted 2 tests of the city's wastewater system for the variant and have not found the B.1.1.7 variant. We continue to conduct 2 tests a week, one in the north plant and one in the main plant for this variant, and expect our next results in the coming days. The other point to make is just that overall, our wastewater system is showing kind of a stable level of viral RNA in our wastewater, which is a good thing. We aren't seeing continued growth in the viral RNA wastewater readings, which tends to precede increased case growth. So that stable reading gives us, some confidence in where we are currently. And I know a lot's going to change in the coming weeks as we welcome back many additional residents to Burlington. So we'll be keeping a close eye on how that changes.
Great, Brian. That's good news. We're in this race here to get as much of the vaccine out to the vulnerable populations as possible before this new strain gets here and is widespread. We know that the strain represents a real risk. And so another week without detecting it here strikes me as good news. And it's news that Burlingtonians can do something about it and do something to ensure that it continues. And that brings us to our last topic, which is to talk again about masking. I think there may be, when we talk about the new variant, the best thing that we can do to protect against these more transmissible variants is everything that we've already been doing, but just do it better. And better includes wearing a high quality mask. We've been talking about this the last couple of briefings, and this week the New York Times had a headline with the same message here. And one of the things they particularly focused on was upgrading your mask and doubling down on precautions to protect yourself. So to support that, the city has ordered 3,000 additional high quality masks to distribute for free. And these are expected to arrive here in Burlington and be available before the end of next week. This is on top of the 26,000 high quality masks that we fabricated and distributed with the help of many, many community volunteers and partners last spring. Those one thing that I think maybe a lot of people don't know about those masks is that they were designed to be high quality way back in March. They were tested and designed with support from the Leahy Clinic in Massachusetts and the UVM Medical Center, and they meet the criteria the CDC has more recently included on its website. So if you still have one or more of those 26,000 masks around, those are the ones I wear. They've held up well through the washing machine all these months. I think one of mine has broken, but I've got a few others. And so we encourage people to continue using those. When you have a choice, use those high quality masks instead of some of the lighter, thinner options that are out there. Brian, you want to add anything on that? And you want to just speak to the city mask policy too?
Mayor, sure. I'll do that quick because I think there may be one more topic too for you after this one. And that just the criteria that the CDC has laid out include kind of a denser weave fabric, a good fit, and a mask that's sized correctly for your face. And that denser weave, you can tell by holding your mask up to the light and trying to understand how much light gets through. I think the key thing here is that as a community, people have been incredibly good about masking, and that's one of the reasons our community and state have done so well. And so if we in aggregate make choices to use better quality masks in the coming weeks and months, it could have a material impact in our kind of community spread and our ability to contain that.
Great. All right. Thank you, Brian. There is one last non-COVID topic, or I guess in a sense it is related to COVID, which is we can now say definitively how town meeting day 2021 voting will be conducted. Earlier this month, one of the first things that the legislature did when they got back into session was to pass a bill allowing municipalities to send absentee ballots to all municipal voters for this town meeting day. This is basically, this allows us, gives us the authority to conduct town meeting day elections the same way that the fall elections were conducted in November. I am confident that this is how we are going to do it here in Burlington. The city council does need to approve this on Monday, but I have been in conversation with President of the City Council, Max Tracy, and I know he supports it. He's sponsored the bill along with other councilors, and I'm hopeful that this will have broad support on Monday. The city will mail ballots to all active registered municipal voters no later than February 10th as a result of this, assuming the council passage on Monday. If you need to register to vote, update your address, or mail your ballot or have your ballot mailed to a different address, please contact the city clerk's office as soon as possible at those numbers or at the email address listed there on the screen. And in terms of returning those ballots, once you get them in the mail, there will once again be a variety of options for doing that. You'll be able to do it by mail, by city Dropbox. There will be a fourth city Dropbox location, it's my understanding. There were 3 for the last election. There'll be a 4th now out in the New North End, or at your polling place on town meeting day, if you do want to vote on election day. With that, we've gone through a lot. We'll now open this up for questions.
Great, and we do have a few questions in the queue. Reminder for members of the media, if you'd like to ask a question, you can just send me an email and I will get you in the queue. And first up is Matthew from NBC5. Matthew, you should be able to enable your microphone now.
Can you hear me, Mr. Mayor?
I can, Matthew. Yes, welcome.
Perfect. Appreciate it. Thank you very much. First question, I don't know if you're aware of the report by the state in regards to the Elderwood facility in the city about just the treatment that the residents received. Just want to get your reaction to that. You know, these are residents of Burlington and they received some pretty rough treatment, and just, you know, what's your reaction to that report?
I was very disappointed to read about that treatment in the report. I think it's tragic. And I applaud the family members of the residents for coming forward and making clear what was going on. And I'm glad that the inspection system has found these violations as well. And it's beyond that, looking forward, clearly this whole pandemic, I think, has really raised real concerns about the long-term care facility, the strength of those facilities nationally and here in Vermont. And I think part of rebuilding from this pandemic is definitely needs to be looking at those, how this system runs and what we can do to strengthen it, because this is certainly not isolated, that this is the only thing that has gone wrong in these long-term care facilities during this pandemic.
And the other quick question I had was, we've heard from both Champlain and UVM about, their return plans and, what they're doing to ensure that, the numbers continue to stay low like they did in the fall. But just your final message to Burlingtonians and, the general Chittenden County community about all these students returning. They hear this, but they still might be skeptical about cases rising in a time where cases are already high in the state.
Yeah, I mean, my message to Burlingtonians is we in UVM and Champlain College, we have had partners that are fully committed to keeping the community safe. They have made major investments to do so. I think they have earned in the 2 prior rounds our trust and earned the ability to try to make this work once again. This is one of the reasons we have had such an aggressive box it in pandemic response effort is to keep our schools open and to keep learning going. And we have seen that be successful at in the colleges in a way that bucked national trends in the fall. We have seen, even amidst these elevated case levels within our public schools, which are not able to do as much testing and containment as the colleges will be doing, we've seen in-person learning succeed there. So I support the effort to make this work. Once again, it is very important, if we can do it, that this happens. So I support the attempt, and we'll be watching very closely, looking very closely at the data, meeting on at least a weekly basis with the colleges to ensure that if we do start to see problems, that action is taken to contain those problems. And that's where we're going to approach it. I support the effort. I think they've earned the chance to make that effort, and we're going to be watching closely, working closely with these institutions to make sure this succeeds.
Thank you very much. Appreciate it.
Next question is from Seamus at VT Digger. And Seamus, you should be able to enable your microphone now.
Great. Can you hear me okay?
I can, Seamus. Go ahead.
Great. Thank you, Mr. Mayor. And thank you to the representatives of the schools as well for being here. My questions are along those lines. I think this teamwork that's been preached, I think that's definitely been clear. And I think the relative success that the schools have had, I mean, there was a lot of skepticism going into the fall, whereas now we have a much clearer picture of, I think, what the reopening looks like, which is obviously a good thing. That being said, in January, I believe the latest data coming out of UVM were 59 positive tests, and that compares to 99 across the whole semester for the last fall. So it's kind of this balance where people have a much better understanding of what it takes, and the students have proven that they can do that. But cases are on the rise. And so the question is, I know we don't want to talk worst case scenarios, but is it also a joint decision when it comes to, potentially moving fully online? We know it's been a collaborative effort to sort of make the spring semester happen. But what's the communication when it comes to making a decision for Burlington?
So, Seamus, I think I understand your question. I guess, let me, again, not to be repetitive, way back let's just go back for a second. I just want to recap how we got here. I think it's helpful for kind of understanding my thinking at this moment. UVM and Champlain College showed themselves to be good partners in this effort by taking a really important early decision in this whole pandemic last March and deciding not to have their students come back after spring break. I think that's been underestimated as a key decision that really need to be made quickly, and it really helped keep Vermont very safe during the early stages of this pandemic. This summer and again in the fall, we demanded coordination and good communication between the institutions, and there were some tough moments in there, but we got that and we succeeded together. And again, I think the institutions have earned, they want to try to do this. They believe they can do this safely. I think they should have credibility. They have credibility with me. I hope they have credibility with the people of Burlington when they say they're committed to trying to make this successful and that their students are committed to it. They proved that over the course of the fall. They didn't prove that they can succeed, but they proved that they're committed to it, and I think should be given a chance to make it work. I'm going to be watching very closely. Brian our Chief Innovation Officer is going to be having these very regular meetings. We're going to be demanding information as we start to see problems emerge. If we get to the point where we're not comfortable that this containment of the virus is under control, I will be vocal about that, as you have heard me raise concerns in the past. And I do believe that our college partners will be responsive to the city. They have been up until now. I don't have, when you sort of ask who's in charge, the city has very little formal authority here. We don't have a health department. But nonetheless, we have found a way to work together and succeed up until this point, and we're committed to continuing that through the rest of these critical weeks and months.
Great, thank you. Yeah, that definitely answers my question. I appreciate that. And then the other would be for the school representatives, just more of a procedural thing, a procedural note on the state ban on multi-household gatherings. Is there a certain way that you're defining households to make some of these non-academic gatherings possible, that socialization possible, while staying safe, and also making sure that you're adhering to state guidelines?
So Seamus, Gary from UVM. We are defining a household for on-campus purposes as an individual room, single or double, or a suite on campus. The state gave us in the restart plan several options that we could go with, but we decided to keep that a very narrow definition. And for our off-campus students, it's an apartment or a single dwelling where multiple students or tenants live. And we're putting that up on our website shortly. We're communicating it to the university community early next week, defining that. But that gives us then, because the state gives us the ability to have those social gatherings, events, meals, library, classes with mixing of households if we have all the safety guidelines that we have put in place throughout fall semester. And we expect to continue that.
And Seamus, I know that Champlain College had to hop off early, but I could connect you with them offline if it would be helpful to hear from them as well.
Sure. That would be great. And thank you, Gary. I appreciate that. And once again, Mayor, appreciate it. Thank you. That's all I have.
Thank you, Seamus.
Next question is from Devin at 2244. Devin, you should be able to enable your microphone.
Hey, Mayor Weinberger, can you hear me?
I can, Devin. Go ahead.
I hope all is well. My question is somewhat unrelated to the press conference today, but Councillor Hightower and former Governor Howard Dean held a press conference today, ranked choice voting related, launching the Better Ballot Burlington campaign. I know last year you had vetoed putting that on the November ballot. This would be obviously for 2022 if it's passed. I just was looking to get your thoughts, your reaction to the push for ranked choice voting and where you have sort of stood on it as it stands right now.
So thank you, Devin. The difference now between the bill that the form of this that I vetoed is this is now happening on town meeting day. We're going back to the voters. I think that was a right call, the veto last year fall, because it would have been very challenging, very expensive, but more importantly, and this sometimes got kind of under a little bit lost in the message, it would have been very hard to conduct under these extreme, unprecedented circumstances, both a local election and a national election at the same time last November. So I'm glad that we didn't have to do that, and that instead this is now coming forward as part of the town meeting day ballot, and that's why I was against it then. But this one, I supported it going to the voters. In terms of my personal opinion as a voter, how I'm going to vote on this, I mean, I'll be clear. I grapple with this a lot because a lot of people I respect a great deal support this, and I know that there are elections that in other jurisdictions where some kind of non-traditional voting, some kind of maybe ranked choice voting or one of the other systems is very much needed. I think you can look at voting systems like, I believe there was a congressional race down in Massachusetts last fall where there were many people involved in a primary, and as a result, a very conservative candidate who had switched parties ended up, getting the Democratic nomination with a very low percentage of the vote. That's a problem. That's a flaw in a voting system. My challenge is I will not be voting for it. I continue to be where I've long been, having experienced directly the two times that we had ranked choice voting. I don't think it was a system that worked well in Burlington elections. I think it to me, it really detracted from the public's information and knowledge about the campaign. I think it really led to it it led to campaigns being very hesitant to define distinctions and differences between themselves on substance because of concern about alienating second or third votes of other candidates. I was a campaign chair of a mayoral election during that period. I just didn't think it worked well. And so I came to the conclusion that it's not good for Burlington. I'll be voting against it here. I just don't see any here in Burlington. I think the traditional system has worked well, and it's worked well for decades. And I don't see a need to change it. At the same time, I acknowledge that there are other elections with different circumstances, different structure to them, where innovations are needed.
All right. Thank you, Mayor. That's all I had.
Great, and that's all the questions we have for today.
Great. Thank you, everyone, for tuning in. I want to say thank you again to Wendy, Gary, and Danelle, who left us earlier, as well as Dr. Leffler for joining us. Thank you, Wendy, Gary. Looking forward to, you've heard the concern from the community, and I'm committed, as you've heard, to moving forward together in the weeks ahead and making this work and proving that we will succeed if we can, and recognizing it if we can't, and taking action from there. Thank you for being on today for us to have this really candid, transparent conversation with the community about where we're at.
Thank you, Mayor. We appreciate it.
Take care. Bye-bye, everybody.